Thank you guys for joining us. So this is the first part of our Biome Effects, Intro to Biome Effects, where we're going to learn so much about what this test is and what we can glean from it. So just to start us out, I just want to take a poll. So please put all the answers to our questions in the chat box. But if you do have questions, Sarah's going to be working through them. Please put those in the Q&A box because we don't want to miss them if they're in the chat box. So how many of us are currently using Biome Effects? So 1 for yes, 2 for no. So just get an idea. Awesome. Oh, lots. Okay, great. We got some newbies. All right, a nice mix. Love that. So for those of us who are not currently using Biome Effects or who are brand new to Biome Effects, do we use other stool tests in our practice? Are we familiar with using other stool tests? Well, I didn't put it. So 1 for yes, 2 for no. Great. Awesome. So we all kind of speak the same language already. I'm always curious to see, who's new to this. Okay, so this is likely a review. And obviously, if you've taken our foundations webinar where we go, more in depth into the microbiome, the different functions, and the functions of the microbiome and how important it is for human health, right? We all understand the importance of the microbiome. We all understand that when it comes to our overall health, our well-being, we have to consider the microbiome. And I like to think of the microbiome really as our foundation, right? It's like the foundation of a home. You can have the most big, beautiful house. You can have everything you want. It has all the bells and whistles, but all of a sudden you get that report back that shows that there's cracks or there's, not a strong supportive foundation. So the question then is, would we still buy that home, right? So because our microbiome is that foundation, as we go through life, we experience different things that can impact that foundation, right? What I like to call microbiome disruptors. And this can actually impact the overall health of the microbiome. So a healthy microbiome produces important postbiotics and metabolic byproducts that perform functions that are so necessary for our health. We know it contributes to having a strong intestinal barrier, making sure we have low inflammatory load. And most importantly, it builds a more resilient environment, right? One that's less likely to experience chronic disease. So if you've been to any Microbiome Labs talk, we use this image quite a bit because we like to always talk about what does it mean to actually have a healthy gut or a healthy microbiome. And if you go through the research, this is really new research that we're learning more about what it means to have a healthy gut. So healthy guts obviously are going to have good diversity. We're going to talk a lot about that today. We're going to have a low level of pathogens. We're going to have strong mucosal layer, those strong tight junctions, right? So leaky gut or dysbiosis, right? We're going to look at having an imbalance, right? So essentially dysbiosis is just an imbalance in your microbial ecosystem. And we have low keystone strains. We're going to talk about this a little bit more. These are what we call the Instagram influencers of the microbiome. And they don't take up a lot of real estate, right? They don't take up a huge portion of the microbiome, but they have a disproportionate influence on the overall health. So Akkermansia and Faecalibacterium and our bifido species. So it's not a good thing if we have low diversity of these guys, and that can really impact short chain fatty acid production and start to decrease the amount of short chain fatty acids that are produced. So with having low diversity, with more pathogens, with low keystones, this starts to disrupt the mucosal barrier. And essentially when we have a dysfunctional gut barrier, then all these inflammatory byproducts and inflammatory components and bacteria can enter into circulation and essentially activate the immune system. Oops, there we go. So when we think about that foundation, what is actually driving those cracks in our foundation? This is what I like to think of as the earthquakes, the hurricanes, the bomb cyclones, right? That create those cracks in our foundation. This is what we call the exposome, microbiome disruptors or dysbiosis risk factors. And the exposome are all the things that we can be exposed to that can influence the microbiome and play a role in the overall resiliency of the microbiome. So medications and natural antimicrobials, infections, lots of alcohol and smoking and stress, right? Travel. These are things that a lot of us have either deal with in our own life. Like I have stress, we all have stress. You guys didn't hear me earlier. I have an almost 2-year-old and she's like Dr. Jekyll, Mrs. Hyde. So lots of stress at home with that. And I have to travel for work. And we know that lots of people are eating more of the standard American diet, lots of saturated fats, environmental toxins that we really can't control sometimes what we're exposed to, like glyphosate and heavy metals, lack of sleep, even intense exercise. And we ultimately want to see, right, how does this exposure, how does this exposome actually impact the microbiome as a whole? And more importantly, what we really want to start to determine is when we're exposed to these microbiome disruptors, how do we actually begin to restore the ecology and the environment within the microbiome, or build a more resilient microbiome that can withstand these microbiome disruptors? Because ultimately, right, the changes we see within the microbiome, right, when we have that loss of structure, the more translocation of bacteria and bacterial components like LPS, the more inflammation we see and the immune activation that follows, this doesn't just remain in the gut, but it does impact beyond. And we know that now through the research. I mean, that's pretty profound in looking at the microbiome's impact on the gut and beyond the gut. So how does the microbiome impact the brain and the skin and our metabolism and our lungs? So we have all these different axes that exist, and the crosstalk that exists between them, so that we can now start to determine on what's the impact that the gut is having beyond the gut. So when we look at what a functional microbiome analysis is, it's really there to provide us with the insight and as well as the data on how the microbiome is being impacted by the exposome, by these microbiome disruptors, by conditions that we're dealing with, even, again, how our diet, so all the things that, we're doing within our lifestyle. And so it can really give us insight into how well our microbiome can actually handle those disruptors, and how strong is our foundation, and how can this actually be driving some of the clinical presentation that we see with our patients that we work with, and more so too, how can we work on improving the foundation to even prevent certain conditions from occurring in the first place. So a functional microbiome analysis provides that insight and the information to better direct our care plans on how to actually restore that balance and how we can actually start to build that resiliency and to rebuild our foundation. So this is really where that paradigm shift comes into play, that paradigm sort of mindset that comes in. And so when most of us think of a gut test or a stool test or a microbiome test, we really aren't often thinking of a functional microbiome analysis or what Biome Effects is. We're usually thinking of something more like a parasitology or even a stool chemistry test. So lots of different options out there. And we're going to spend the rest of our time today in learning more about what a functional microbiome analysis is and how it differs and how we can use it to guide us clinically. Okay, so what is Biome Effects, right? What is a functional microbiome analysis? So in the traditional sense, a lot of our traditional stool tests, like when we go to our PCP, or a lot of what is used even in the conventional world, and even more so what a lot of us use even functionally, we're looking for some type of diagnostic test. So stool chemistry, microbiology, parasitology, what we're essentially looking for is something to diagnose, so something to explain our symptoms, or something that's necessary to go in and eliminate, or something that we're looking to specifically target and help improve. And this is where a functional microbiome analysis is actually different. We're focused more on gaining the information that the microbiome is actually telling us. So, what's the story of the microbiome? What can we tell from someone's microbiome that's potentially setting the stage to learn more about what they're actually currently dealing with, or to learn more about their symptoms and how their symptoms are impacting beyond, and what can we do to actually prevent something from even occurring in the first place. So this is using a different technology, something called whole genome sequencing, and we'll talk more about this. And we're essentially getting a deeper report that provides not just who is in the microbiome, but also providing the functions of our microbes. So what are they actually doing there? What type of microbial signature do we see that gives more insight into someone's diet, lifestyle? What types of, how these microbiome disruptors and dysbiosis risk factors are actually impacting the microbiome as a whole. And then essentially, what do we need to do to support it? So what do we need to support that? We have to work on increasing our balancing. How can we target and make more individual recommendations that begins to actually strengthen and build that resiliency to our foundation? So we are actually looking at two different tests. So how do we differentiate between a functional microbiome analysis? So a functional microbiome analysis, first off, is really going to focus on the functions of our microbes, the byproducts, versus just focusing on who is there. And this can really help provide clues into clinical symptoms and as well as giving the clues into how the microbiome is actually impacting us beyond the gut. So we're looking at different metabolic byproducts um, and the functions. What are our microbes actually doing in the microbiome? It's also going to focus on creating a healthy ecosystem that's going to naturally do what it's supposed to do, which is to limit pathogens or to have our microbiome and our commensals and really the microbiome deal with those pathogens on its own. So really more of this sort of build up versus kill paradigm shift. And I always like to have this kind of be part of that sort of paradigm shift, right? In asking ourselves, can someone's microbiome actually withstand more aggressive protocols? What if they really don't have a strong foundation? Then are they going to respond to the treatment plans that we're really setting up and wanting to use on our patients to help them feel better? And not only, how the microbiome is impacting the GI tract, but how is it driving symptoms and conditions beyond the GI tract? And how is our microbiome setting us up for things that can start to occur beyond? So looking at different microbial profiles and signatures that are indicating dysfunction along the gut-skin axis or the gut-brain axis or the gut metabolic axis. And then, of course, giving us a little bit more insight into why we see certain markers that may be elevated, like secretory IgA or beta glucuronidase, really getting down to the root of what could be driving changes in those markers and causing those markers to be elevated or to be out of range. And so we're really looking at the root. We're really getting eyes on that foundation. So let's go into functional microbiome analysis, right? The first step to becoming a microbiome or becoming a microbiome expert is to take a look at the microbiome. Okay, so when we get into the report, we're going to go through many of the sections, but the first section that we really look at there, and in general, right, when we look at some of the who is in the microbiome, there's kind of three main questions that we're wanting to look to achieve, really, when we're studying the microbiome or getting eyes on the microbiome. The first question is obviously who is in the gut. So what is the relative proportion of community members, right? We're getting a look at diversity. Diversity is a lot. We're gonna talk a lot more about that, but we want to know who's in the gut and what's their relative proportion. How rich is the community? How evenly distributed is the community that we're looking at? What are they doing there, right? So what functional chemistry is actually being carried out, and how do our microbes interact with not just the environment that they're in, but how do they actually interact with each other to carry out their necessary functions? And we want to know, is there balance, right? So is there balance in that microbiome? Our microbiome is like Goldilocks, not too hot, not too cold. And we're going to learn that with a lot, that when we can have balance in the microbiome, this promotes immune homeostasis, and this helps to support the gut barrier. So a lot of that focus is being on balance. And then finally, the question that becomes, or that we want to ask, is how do we actually restore that balance and that strength of the foundation of our microbiome? If we don't focus on building strength and resiliency, patching up those cracks in the foundation, the patient then is obviously going to most likely continue to experience symptoms or continue to experience decline in our health, because we continue to be exposed to those microbiome disruptors. So we can't really avoid a lot of those. I mean, they're just part of our natural life, but what can we do to make them less impactful? And again, how do we start to build that strong foundation? So the first section of the test is focusing on diversity. So our first measure is what's called alpha diversity. So Biome Effects is the only stool test really that looks at both alpha and beta, so quantity and quality of species. So your alpha diversity is a quantity measure. So it's looking at the richness and the abundance of species within the microbiome. And this is really important because we know that obviously there's lots of differences, but when it comes to having a healthy microbiome, diversity is really key, because as you start to lose diversity, we sort of set the stage for more unfriendly bacteria to take place and for more of that breakdown to occur. So this does vary person to person. And oftentimes when we read the research, we see like we should have up to 1,000 different species of bacteria. And we know that's not as true anymore. And some of that is actually based on some older technology, which we'll talk about. But with all that data, and what we sort of know now is that we want to see a healthy range between 150 and 250 species. We don't often see it above. And I think that just reflects a lot of the world we live in, industrialization, our diets, our stress, right? All the things we know impact the microbiome. But really the bottom line is you can't have a healthy microbiome with having low alpha diversity. It's really hard. So I think of, in this case here, where we look at this person, she's got like a desert, really, this really not much going on. And so this Shannon index, which is sort of a more sophisticated measurement, it's not just looking at the pure number of species, but looking at the abundance, the uniformity. So the lower this number, the less uniform, the more you only have 1 or 2 or 3 species that are really dominating the microbiome. So this person, I would say, has a desert. Beta diversity is quality. So quality compared to what we see in the healthy species in the healthy US gut. So really looking at how much opportunistic bacteria are present or how much pathogenic bacteria there. Are we actually lacking more of those commensal and healthy species? So the lower number, the lower score of this, we know that they're not really containing a lot of the species that we want there that resemble a healthy population. And again, as we discussed, right, having low diversity is just a hallmark feature of a dysfunctional gut. We start to lose that diversity. It just creates a microbiome that's more susceptible to pathogenic and opportunistic bacteria. Resistome is another marker for resiliency. So we know that microbes compete with each other by producing natural antimicrobials and genes that create microbial resistance. And so we're capturing over 1,500 antibiotic resistant genes. So the more antibiotic resistant genes to antibiotics and medications and foods, the lower the score. And it does compare obviously to a healthy reference range. We know that lots of different bacteria, but mostly pathogens, are who produce antibiotic resistant genes. So when we look at the resistome, right, a lower score is going to be a less resilient. So a stronger and more diverse gut microbiome is obviously going to be more resilient and be able to withstand things like antibiotics and continuous exposure to antibiotics better. So someone who's exposed to lots of antibiotics, we would expect a lower diversity, lower keystones. So if this marker is low, then we really want to work on building that diversity. So the pathobiome, this is another resilient marker. So how resilient is our microbiome against having pathogens, and how well can it handle having pathogens there? And we know now through the research, lots of microbiome studies have shown that pathogens, even though in higher abundance and have the potential to cause infection, that really in low amounts, as they start to increase in abundance, that they just have the ability to really impair the function of the epithelial barrier, where we know our commensals have, are more of that gatekeeper, right, to protect our epithelial cell integrity from penetration and from disease or from symptoms and from conditions that we know these pathogens can cause. So our pathogen control index, the lower the number, the more abundance of pathogenic species we have. And this is the section where I actually really have providers and practitioners kind of pause to stop and think, because just the presence of pathogens isn't indicative of symptoms or infection. It's more about how the pathogens are actually changing the GI environment, how they're potentially making it more friendly for other pathogens to come, right? Inviting more of their friends to the party, or a neighborhood where you move in and you move next to the neighbors that you don't necessarily want to live next to. So they're inviting more of their people to come and move in. And really because pathogens start to decrease that function of the epithelial barrier. So they begin to drive that dysfunction we see that allows bacteria and bacterial components, right, to essentially drive immune activation and inflammation. So many of us will see this and we'll think, okay, we need to kill, we got to get rid of pathogens. We don't want any pathogens. And that's not the case, because pathogens and opportunistic bacteria can live harmoniously in balance with our commensals. But the more we have, the more they'll compete for substrates, and the more they'll actually start to decrease the ability for our commensals to get the food that they need to thrive and survive. So if we just kill, if we just kill pathogens, and let's say someone doesn't have diversity, maybe they're already a desert, then suppression without really focusing on building diversity is just going to perpetuate the problem. So it's really challenging ourselves to take a step back and actually look at the microbiome as a whole, in figuring out how these pathogens are not just affecting, the host, but really how they're potentially changing the microbiome and the way our microbes function. So we look at different bacteria, different protists, as well as fungi. The next section of the test looks at dysbiosis ratio, so really giving us an overall balance report on how balanced the microbiome is by looking at our 4 major phyla, phyla being the largest umbrella. So we have 4 predominant phyla in a healthy population. So Firmicutes and Bacteroidetes, as well as Proteobacteria and Actinobacteria. And an imbalanced ratio is really a clue for dysbiosis, right? And as well as inflammation. And we can really get even clues into imbalances in someone's diet, as well as even their digestion. So Firmicutes and Bacteroidetes, these make up about 90% of the microbiome, and it's about 1-to-1. You know, some research will show that we should have slightly more Bacteroidetes, but it's fairly close. We've got pathogens that live within the Firmicutes phyla, but also lots of keystone species and commensal and important species as well. So the ratio is really important in giving us an idea of how that balance could be impacting us clinically. And so we know that a low ratio is often more associated with a healthier metabolism. But when that ratio is too low, it can also be a sign of inflammation. It can be a reflection back on who's not there. Maybe we aren't feeding appropriately. So again, giving us those clues into who isn't in the microbiome that we want potentially, and how are we potentially feeding them or not feeding them. We'll talk more about that. But an increased ratio, so when the ratio is really high, like in this case, it's like really high, this is associated with more unwanted weight gain. We see this associated with more metabolic conditions and insulin sensitivity, a decreased insulin sensitivity, increased inflammation, you know, gut liver axis dysfunction, even SIBO, right? Are we just over fermenting and just producing a lot of imbalance, right? Especially in terms of the bacterial component. We know that this is going to change depending on where we are in our age. It's low in infants, it increases as we go, and it will actually decrease again. So really in those adult years, our microbiome is fairly stable, but it's flexible. So because we get exposed to things that we know can disrupt the microbiome, we start to see some of those changes taking place. Proteobacteria to actinobacteria. So Proteobacteria is one of our most pathogenic phyla. It contains the most gram-negative bacteria, which is our most LPS containing, LPS being a bacterial endotoxin, right, that sits on the cell walls of our gram-negative bacteria. And then our actinobacteria has lots of butyrate producers. We also have lots of actinobacteria in the oral microbiome. So an elevated ratio is linked more towards intestinal permeability, inflammation, dysbiosis. Think more like, again, what happens when LPS gets into systemic circulation, it can drive a condition known as metabolic endotoxemia. So really triggering that innate immune response that we see. Whereas a low ratio can actually, when the ratio is, you know, below normal, this can actually give us a clue into digestive insufficiency. Since we have lots of actinobacteria in the oral microbiome, then that's sort of telling us that we have more oral microbes showing up in our stool. And so they're not necessarily getting neutralized or killed in the stomach. So giving us a little bit more insight into maybe someone has digestive insufficiency. So as we go through the test and we start to look at some of these patterns or what we can glean from it, we can start to see if we if what we're noticing from these ratios, if what we're seeing further down into the test is actually corroborating what we're seeing. So these dysbiosis ratios give us a lot of clues, and so very helpful. Now, I love this one because proteobacteria is a nice marker for how much LPS someone can be having. And so proteobacteria, we know, really thrives on saturated fat, more of a standard American diet, sugar. And actinobacteria likes a lot more fiber since we have lots of butyrate producers there. So if your proteobacteria and actinobacteria is elevated, this also gives us the ability to focus on who are we actually feeding. So how can we actually modify the diet to make sure we're feeding more of the microbes that we know produce short chain fatty acids to help get a little bit more function out of those microbes. Keystone species. So this is another section of the test. Keystone species are beneficial bacteria that don't take up a lot of real estate, really only up to maybe 5% of the microbiome, but they're our most potent short chain fatty acid producers. They are also really helpful in creating a more friendly environment that allows our good microbes to thrive. They keep the intestinal pH slightly more acidic, which our pathogens don't really like. We know our keystones also play a huge role in gut-brain functioning, as well as other gut organ axis functioning. They really do assist in that microbiome immune system crosstalk. But these are also like Goldilocks. So remember what I said, the microbiome likes balance. So even in this case here, where we see that many of our keystones are not detected, but even of the ones detected, they're really out of the range that we like to see or what's most noted in the healthy population. So it's another sign of dysbiosis. And that's something we do want to think about. There's even studies now that have shown, and it's speculative, but we're getting more research to indicate it, but even really high Akkermansia being a microbe that helps to rebuild that mucus barrier. But having high Akkermansia could potentially mean, well, that microbe's working too hard at building that, and maybe it's a sign of inflammation. So again, we really like balance. So even if you have these and they're all out of balance, it's another sort of indication of an imbalance or dysbiosis. We also look at the breakdown, again, between obviously our predominant phyla, but also our less abundant phyla. And these can give us insight into obviously who is taking up the most real estate in someone's microbiome, who should be there, and who isn't there that we potentially want there. So again, these are some of the big questions that we're looking at. It's not so much of a, you don't have this and it causes this. It's how are they actually working together in the environment that they're in. So balance is really necessary, right? Balance is necessary because it creates competition. So it allows for then those microbes to compete for nutrients so that they're actually performing their necessary functions. And some of these less abundant phyla can actually give us some clinical clues, I like to say. So like eukaryote, for example, this is where archaea. So these are strong methane producers. So think about constipation or intestinal methanogen overgrowth. Synergistides, this is very much correlated with oral dysbiosis, gingivitis. If we have lots of synergistides, again, they're not neutralized or killed in our stomach acid. So this can be a sign if someone has elevated synergistides. Same thing with Candidatus saccharobacteria, which is predominant in periodontal disease. Well, then we're getting more of that bacterial translocation, which is showing us that we don't have maybe sufficient stomach acid. So again, another sign of digestive insufficiency. Fusobacteria is very inflammatory. It was just in the news recently that a very specific strain of Fusobacteria is being linked to higher rates of colorectal cancer. So again, we can't diagnose based on microbes, but if someone has really high Fusobacterium and they've got lots of GI symptoms, we need to be asking questions of, have you had a colonoscopy? Have you had, any workup done just to make sure that things aren't being manifested, and just can give us a little bit more insight into how to correct for that. The family section. So again, it's another section that's looking at how balanced are we. So having these families, which is more specific than phyla, right? We get a little bit more specific as we work through that taxonomic hierarchy, and we'll talk about that later. But having these families out of range isn't necessarily a bad thing, but knowing these can provide you even further clues and insights into some of those clinical patterns or microbial profiles or signatures for certain conditions that we know exist. But again, it's just going to give you an insight into who's not there that should be there and who is there and in greater abundance. So the next section of the test, so that's the section of the test that's really focused on taxonomic profiling. So the next section of the test is really looking at the functional analysis. And this is what separates Biome effects and a functional microbiome analysis from other stool tests on the market, is that now we get to see, okay, maybe you don't have, this is what I will usually say to providers and practitioners in consultations, is we're getting an idea of what type of neighborhood you have. Maybe you don't have much of a neighborhood at all, and maybe it's a desert and the land's quite not ready for us to build on. Well, let's see who is there and how they're functioning. Or maybe you have this big, beautiful neighborhood that looks really great and we want to live there. And then we move in and we find that the neighborhood's not really functioning the way we want it to. So this is a really key part in learning more about how our microbes are actually acting in the environment that they're in. So what does the functional microbiome analysis or the functional analysis section tell us? It's essentially mining for samples for genes, right? So the genes, the bacterial DNA, the genes in the bacteria that are actually known to contribute to the production of these metabolically important functions. So this is where we can look at saccharolytic fermentation. So how much butyrate and propionate and acetate and lactate are there. We also look at proteolytic fermentation, and we're going to go into more depth with these. Hormones and neurotransmitters, and vitamin biosynthesis. So all of the things that we know our microbes do. So I love this section, right? Because again, it's going to give us a lot more of that insight into how the microbes are actually functioning. It's going to give us, clues into how, having a strong, resilient microbiome, even if we have lots of bacteria there, if they're not doing what they're supposed to do, how can we actually start to support that? And this can really tell us a lot about when we consider these functions, right? And so considerations, obviously, if they're high or low, there's a few things we can really start to look at. So the first thing is if our functions are low and or high, maybe it's because we don't have the fermenters there, right? Who are we missing? Why aren't they there? Is it because we aren't feeding them appropriately? Is it because we have such low diversity? Is it because we're exposed to lots of dysbiosis that's decreasing that diversity, right? So it's going to give us a little bit more insight into that, as well as diet. Diet's a big part of this because as much as we work with patients' diets, we always talk about diet, right? This is why I became a dietitian, is I love talking about the diet. But the diet needs to be individualized, because if we can actually understand how the diet impacts the functional capacity of our microbes, it can actually help us improve the health of the microbiome. So when we have these shifts in our saccharolytic and proteolytic fermentation, so the breakdown of our complex carbs and our carbohydrates and the breakdown of our proteins, maybe too high, is it because we're feeding certain microbes more, right? So it can really give us clues into how the client's diets or our patients' diets is actually impacting the microbe's ability to make short chain fatty acids, or potentially producing byproducts that are potentially very harmful. And then also digestion, right? If you don't have enough stomach acid, if we're lacking digested enzymes, then larger molecules of carbohydrates and or protein or fat are going to escape and get to that lower part of the intestine, your colon. So there's more for those microbes to feed on. So if you've got lots of dysbiotic bacteria there and you've got larger molecules coming through, then especially things like protein, then you have the potential to yield byproducts that are more harmful. So these are some of the things that we sort of glean. And when we go through the functional section, we can really get clues into not just how the diet's impacting, but also which byproducts are elevated and what can we do to start to support that. So we're going to go through a few of those sections today. We won't go through all of them just because we don't have enough time. But as you continue through your Biome Effects series and webinar, you'll start to get a lot more information about each of these sections in a little bit more depth. So saccharolytic fermentation, so this is measuring the bacteria who are known to produce short chain fatty acids. So are all of the ones there that need to be there that are making short chain fatty acids like butyrate and propionate and acetate. But again, we can also get a sense of someone's diet. Are they consuming the substrates that we know are necessary to produce short chain fatty acids? So thinking of things like our resistant starches and all of those functional fibers that we know a lot of us are lacking, and many of us are lacking in the diet. So this bell curve is going to give you an idea of where someone's short chain fatty acid production is. And I always stop people too, because again, to start to think a little bit clearer, if short chain fatty acid production is high, remember I talked about it in the last slide, a lot of people will automatically think, oh, that's a good thing, you have lots of butyrate. But think back to the rest of the test. Do you have lots of pathogens? Do you have low diversity? Does it make sense that we're seeing high butyrate? And if it's high, is it because we're potentially over fermenting? So we really still want to consider the rest of the test in making sure that this makes sense. If someone has really low butyrate production, but they have decent diversity, maybe they don't have a ton of pathogens or a ton of opportunistic bacteria, maybe their diversity is okay and their short chain fatty acids low, then we want to look at the diet. Are we not feeding them? So it can really take a step back and start to ask our clients questions more about their lifestyle and their diet, and how to really glean information of, does it make sense that someone's short chain fatty acids are high or low? Let's reflect it back on the rest of the test, and then help us, again, move forward into thinking about how do we diversify their diet? How do we create more diversity, right? Using different supplements, focusing on different diet plans. So a lot of questions we get. So how is looking at the functional profile? So obviously the genes, right? The bacterial genes that are known, the bacteria that are known to produce short chain fatty acids, the genetic pathways. How does this differ than stool measurements, which is called metabolomics? So this is a big question we get. And we know that stool short chain fatty acid production, and we see this a lot through the research, is actually not as accurate of a depiction of total short chain fatty acid. And some of that is because the location of short chain fatty acid absorption occurs in the colon. So that's prior to reaching your rectum. And so your stool measurements may not actually represent that total production or even absorption within the gut. And we actually see this. There's been research to show that people that have obesity have higher stool butyrate levels. And that's possibly indicating more of a decreased absorption in the colon, or even decreased microbial utilization, and not necessarily due to actual higher production. We also know that it varies depending on someone's diet, which we've talked a lot about. It varies on the gut microbial composition. Do you not have a lot of those short chain fatty acid producers there? But also transit time is an important one. So one stool sample may actually not reflect the ongoing dynamics of short chain fatty acid production. There's even studies now that show that the time of day can impact total short chain fatty acid production, especially in the stool. So they found that, even later on in the day, that potentially short chain fatty acid concentrations decrease, and some of that could be because of eating behaviors and meal timing. But even they've now know that circadian hormones can play a role. So again, if we're actually looking at the genetic capability, if we're actually looking at the bacterial genes, then it's a more accurate measurement because it's more about the bacteria that's there. So your functional analysis is going to give you a little bit more of a broader view, whereas stool measurements of short chain fatty acids is only going to give you that information on your end product fermentation, right? It doesn't give you insight into those microbes and the functions and the ones that are actually able to produce short chain fatty acids. So proteolytic fermentation, this plays a key role in a lot of microbiome related issues, but we know our gut microbiota can also metabolize amino acids into very specific microbial metabolites. And yes, these have some benefits in small amounts, but many of them in larger quantities actually play a key role in things like intestinal permeability, inflammation, and neuroinflammation, even in, again, your gut barrier, your immune system. So we go over this a lot, obviously, in our foundations webinar to talk more about this, but proteins and peptides that are essentially escaping digestion. So we know protein gets denatured in the stomach. So larger protein molecules that are actually making their way into digestion are going to be available for proteolytic fermentation. So amino acid fermentation will typically occur in less acidic conditions. So if you think about how much pathogens or opportunistic bacteria that are there, they will actually increase alkalinity in the digestive tract. So they make it a little bit more favorable for proteolytic fermentation. Or insufficient fiber intake. So more protein in the diet will also create a little bit more of an alkaline environment. So even though we can get some short chain fatty acids from protein digestion or protein fermentation, the other byproducts that are produced, like histamine and p-cressyl, ammonia, and we'll talk about some of these, in high amounts are extremely inflammatory and can become very toxic. And so we want to obviously look at that. And again, this can give us a lot more insight into diet and digestion. And how we're actually feeding our microbes. So if we don't have enough fiber, if we consume a lot of protein, there's just more substrate available. And so people always ask me that. So does that mean like protein's inflammatory, we shouldn't be doing high protein diets? It just depends on, again, what we're seeing in the microbiome. This is why diet has to be individualized. So if you have more of a proteolytic fermentation, if you have more of this shift to these more harmful byproducts, and the release of more of these pro-inflammatory metabolites, then we need to make sure we have sufficient digestion to make sure that they're actually getting broken down. But it also really calls for macronutrient balance and working with someone's diet if they do have a dysfunctional gut. So if you have a dysfunctional gut and you're consuming more protein and you've got a lot more proteolytic byproducts, then we have to work on improving the health of the microbiome so that those protein and the protein that we're consuming isn't yielding these more inflammatory byproducts. So again, it's why diet really needs to be individualized. So ammonia. So we're going to spend a few moments talking about some of these byproducts, but ammonia production, ammonia is the result of proteolytic fermentation, especially with the intake of glutamine. So we know elevated ammonia can be toxic to the gut, to the liver. It can put a strain on our detoxification pathways. But we also know that ammonia secreted by bacteria in the lumen, it doesn't always stay in the lumen. It can actually increase levels in the blood. And then excess ammonia is obviously a neurotoxin. It can induce neuroinflammation. But more important, it occurs when there's an overgrowth of ammonia producers, more of this dysbiotic bacteria paired with excessive dietary protein or poor protein breakdown. So again, ammonia is one of those things where we know it can be pretty toxic to the brain, but this can also help give us insight into different supplements that we're using. Like if a lot of us use L-glutamine, which we know is used so much in the gut intestinal healing world, but if someone has a lot of ammonia producers and high ammonia production, L-glutamine is going to potentially feed those ammonia producers. So we may not want to give it to someone if we see this elevated ammonia. We know that ammonia is also secreted by some more of our dysbiotic bacteria. So hydrogen sulfide production, this occurs when we have, sulfate reducing bacteria or hydrogen sulfide producers that are there to convert your dietary sulfur and taurine to hydrogen sulfide gas. And again, at low levels, it's protective to our gut barrier. And this is the idea that not all gas is bad gas. And one of the questions I always like to ask, so you guys can add it to the chat box, but does anyone know like what's kind of on average the normal amount of gas that people pass in a day or that can pass in a day? Any guesses? I'll tell you, my patients say 10 to 20. Spot on, Connie, way to go. My patients say none, which is just not true, right? You got to have some gas, but yeah, around anywhere between 14 to 20 times a day is actually normal. So at low levels, hydrogen sulfide is cytoprotective. It helps to actually maintain the gut mucus integrity. And we know that the gas itself, serves as an energy source for our colonic epithelial cells. So hydrogen sulfide's fine in small amounts, but as it becomes too much, as it becomes overabundant, it can actually overwhelm the ability of our cells to use it and detoxify it. So then it becomes a problem. And that's when we often get the GI discomfort and the GI symptoms that are associated with it: bloating, rotten egg, smelling stool. So too much can actually disrupt mitochondria and can cause a breakdown of the mucosal layer. So it promotes inflammation. We know it's often associated more with a high protein, lower fiber diet. So obviously, again, looking at the diet, are we digesting? Are we over consuming? How do we need to support more of that balance? And it's produced by a lot of our more pathogenic species, especially our proteobacteria, Salmonella or Desulfovibrio, Bilophila wadsworthia, Fusobacteria. So again, if this is elevated, it calls for looking at the diet. We want to look at fat and protein digestion. We may need to support digestion, but even things like megamarine, which is our gut-specific fish oil, can actually help inhibit some of those H2S, those hydrogen sulfide producers like Bilophila. Methane, this is another marker, right, of proteolytic fermentation. Methane is produced through the reduction of carbon dioxide as well as hydrogen. So at low levels, again, normal and fine, but as it becomes elevated, it can contribute to things like malabsorption and can slow the intestinal transit time. This is what really starts to affect gut motility. Archaea, which is very similar to bacteria, like to consume carbohydrates. So if we have an imbalance, in even an excess, or let's say they're not being properly broken down or digested, then archaea are going to consume these carbohydrates and create more fermentation. And this is what's going to start to cause damage to the intestinal cells and contribute to greater intestinal permeability. So we know that methane can't be utilized by human cells, so it results in that slowing of the transit time. And longer transit time means that essentially food is taking longer to move through the digestive tract. And this is obviously going to impact the amount of saccharolytic and proteolytic fermentation, right? Because a slower transit time essentially is going to mean that food is in the GI tract, is there longer for microbes to feed on. So you can actually yield more of that proteolytic, more of that inflammatory byproduct fermentation, and especially if you have more dysbiotic bacteria or archaea. So we know it's associated with lots of digestive issues. Methanogens consume different substrates, which can lead to further intestinal inflammation. This can impact, detoxification pathways, because if you slow motility, this leads to constipation. So if you're not pooping, you're not detoxifying. Methane can block the conversion of acetate to butyrate, and that's obviously due to having impaired gut motility. And it just leads to like a backup of your end products of those metabolites. And that essentially can lead to worsening inflammation. They prefer more neutral intestinal pH. So again, if you think of some of our dysbiotic bacteria, can lower that pH or create a more alkaline environment, which we know methanogens like. But there's even evidence that methanogens can contribute to weight gain, and it's because of that slowing of the transit time and impairing gut motility. So that will actually increase the caloric uptake from our foods in the digestive tract, and that can exacerbate weight gain and then, of course, exacerbate symptoms like constipation. If methane is low, it's really not an issue. But again, when it's elevated, we have to take things into account like an intestinal methanogen overgrowth. We want to work on that diversity. But I love our MegaGuard for this, because the gingerols in MegaGuard really help to inhibit the gas production from archaea, so can really help with reducing those symptoms. Eukaryote, right? We want to check that because that's where our methanogens are housed. Histamine. So histamine, I feel like I say histamine and then all of our sirens go off. But histamine is important. It's a bioactive amine. Oops, there we go. But it gets a bad rap. It's not all bad. We need it, right? It helps to modulate immune responses in the gut. We know it's important for motility, even in a healthy intestinal barrier. We have obviously endogenous, so our body produces histamine from the gut microbiome, but obviously we get exogenous histamine from foods and the environment. So when histamine is produced in the gut, it can elicit an immune response in other areas of the body because histamine can enter the bloodstream when we have a dysfunctional gut barrier. And dysbiosis, and when we have more dysbiotic bacteria, this will actually cause more of a release of histamine to occur. So when dysbiosis is present, right, we have certain microbes in the microbiome that cause the release of histamine because those organisms are essentially destabilizing our mast cells. So H. pylori is one of those, for example. So our histamine production really needs to be balanced with histamine breakdown. And if not, then this can lead to more mast cell degranulation, higher histamine levels internally, and this can cause our mast cells to produce more histamine. So the higher this number, we often see more correlated with histamine-related symptoms like reflux and urticaria or angioedema, or again, things that we'll notice with more histamine intolerance. So some bacteria will possess enzymes to convert histidine into histamine. And these are things like Citrobacter frundi and Clostridium perfringens and Hafnia alvi. So lots of our pathogens and lots of proteobacteria, but we also have certain microbes that can degrade histamine, like bifidobacteria species and different bacillus spores. So if those aren't detected, if we have low diversity of these really key species, then this obviously leads to an imbalance in our histamine breakdown. So if elevated, this is where we have to look at options. Do we need to add in some histamine support like stinging nettle and quercetin, or do we need to do short-term diet modifications? I like using things like megamarine and HU58 for pathogens. IgG can really be helpful for histamine symptoms. Okay, indole. So indole is a byproduct of microbial breakdown of tryptophan. So we know tryptophan is an essential amino acid, must be obtained from the diet. It's abundant in our protein-rich foods, right? Cheese, poultry, eggs. So again, when we look at the imbalance of it, we have to go back to those questions. Is it because we just have a lot of it in the diet and we don't have the microbes there? Or we have too much of that dysbiotic bacteria. Maybe we don't have adequate digestion. But indole in small amounts, we know it's produced by lots of different bacteria, more than 85 gram-positive and gram-negative bacteria. In low amounts and in normal amounts, it plays a very key role in intestinal barrier support, antibiotic resistance. It has even antimicrobial effects against certain pathogens. It's important for regulating and improving the expression of our tight junction proteins, decreasing inflammation. Even indole has been shown to induce GLP-1, which we know is really big in the news now, right? We're going to be talking about that at our mini keynotes coming up. But we know that these microbial byproducts and what our microbes do, GLP-1 is produced in the gut. So we know this is really important. But in high amounts, high indole can actually change the path that tryptophan can actually be metabolized. And so it will pull tryptophan down what's known as kynurenine pathway and produce more neurotoxic compounds, what's known as quinolinic acid. So then less tryptophan is actually available for serotonin and melatonin, and this actually starts to create breakdown in the mucosal barrier. So again, we really are talking about that balance. So low indole, we may have to look at the diet. Are we not getting sufficient amounts of protein? This is where our Zen Biome product line is really helpful because it's been shown it's sort of that bifidolongum 1714 strains adaptogenic can really help to sort of regulate that indole production and tryptophan metabolism. So if it's high indole, you may also look at Zen Biome products, but again, also look at digestion, look at the types of pathogens that are there. So it can help really direct the types of supplements and the interventions that we want to start to utilize. So the estrobolome. So we know that estrogen dominance, right? This is one of the most common imbalance issues. And from the research, we really do know that a lot of this is, stemming from or rooted in having a dysfunctional gut microbiome. That's a major driver behind estrogen dominance. So estrogen is cleared in the body by being metabolized or being conjugated in the liver. And then the liver sends through bile and it essentially gets dumped into the GI tract. for further digestion by our gut microbiota, so that then it can be excreted, right? And so the estrobolome is the group of bacteria that can recycle or essentially deconjugate estrogens for reabsorption. So if essentially we're working on someone who has estrogen dominance, or let's say they have dysbiosis and maybe a low estrobolome, they can have microbes that are there that actually reactivate those estrogens. If we're looking at, or they have not a low, but have a lot of this bacteria that can actually reactivate those estrogens. So you're taking something that's neutralized to be excreted, we're reactivating it. And when we have an elevated estrobolome, this can actually send it back into systemic circulation. So this really contributes to estrogen dominance and symptoms that we see related to estrogen dominance. So people who are struggling with estrogen dominance, it really highlights the need to work on the gut. So we know that, again, impaired gut can cause an imbalance in our estrogen levels. And the elevated estrobolome can contribute to those symptoms that we see so common with estrogen dominance. This is a marker for beta-glucuronidase, but you're getting a better sense of the bacteria there that actually have this beta-glucuronidase activity, like proteobacteria and streptococcus and clostridium species. And a low estrobolome, right, we know can also contribute to symptoms, but is it because we just are lacking that diversity, right? So we also have vitamin biosynthesis. This is, and I'm almost done. So for those of you who have to leave on time, I should be finishing up, but vitamin biosynthesis, we know our microbes have the ability to synthesize certain vitamins, B vitamins, vitamin K2. So I like to look at this section. This is not a marker of sufficiency or deficiency. It's not blood, right? It's looking at, do you have the bacteria there that can actually produce these vitamins? So what this can really help us do is when you have low estrobolome, especially in things like vitamin K2, which we know is not sufficient in the diet, then essentially it's going to help you minimize that vitamin disparity. And this is really going to call for a need for looking at the diet and or supplementation because we're not getting it endogenously. So one of the biggest, questions and really kind of the final topic is what makes this test different? And it comes down to the fact that it's a different type of technology, what's called whole genome sequencing. And so many of us aren't even familiar with the types of technology that are being used on tests. And that's why we don't put a huge emphasis, but this is a big key difference. It's because of that whole genome sequencing that we can actually get the functional profile. So let's just review, many of the tests that are being used, what's traditionally being used is what's known as 16S technology. And this is a fairly old technology. It actually was created like 40 plus years ago, and it hasn't changed. So the same technology that's being used then is being used now. So think about things, we've had a lot of progression in technology, like our cell phones even, right? But what is 16S? So all bacteria have the 16S gene. And so then with 16S, they're going to utilize what's known as PCR to essentially target and amplify a very small part of that gene. So for example, if you look at this gene, right, this gene contains 9 different what's known as variable regions. And each of those regions are unique to separate species, their own individual fingerprint. So by sequencing these amplicons by using PCR, then essentially what we're doing is we're only identifying 1 or 2 of these regions. So we're taking a picture and we're essentially cutting it up, and then we're blowing up just a very small portion of that picture. And it's because of that that we aren't really getting specificity, or we're not getting accuracy, I should say, beyond the genus part of beyond the genus, because you're just taking a very small portion. And that doesn't really give you a lot of information. If you aren't accurate beyond the genus, then we know that down to that strain level can be the difference between a commensal and a pathogen. So really quick, right? We talked about phylum already. We talked about family. So 16S is really not accurate beyond that genus. And if you get down to that species strain, that could be the difference between a pathogen or a commensal. So if you're only getting a few pieces to the puzzle, you can't assess the function, right? It's not accurate beyond that genus level. We know that the specificity is a lot lower, and the sensitivity, right, is different. So it really affects that total accuracy as far as what we can get from a true picture. So again, 90.8 sensitivity, or the ability to identify true positives. And you can't identify viruses, fungi, or protists. It's really only bacterial identification only. So this is just the difference. So whole genome sequencing, right, includes the entire genome, whereas 16S you're really just taking a small portion of that gene and then you're amplifying it using PCR to just get a few bits of information about that bacterial gene. So what does that mean? So with whole genome sequencing, you can do both taxonomic, so who is in the gut, but also genomic, which is the functions. So who is there, right? For an example, bifidolongum, we know is a GABA producer, but genomics is going to identify that gene or pathway that's associated with that specific function, not the microbe. So what are they doing? GABA production is looking at the entire microbiome, which results in GABA production, regardless of the microbes that are there. So you get a more granular view of the microbiome because you can see beyond just who is there. So with whole genome sequencing, you get end-to-end, you get the complete puzzle. You can see the person that it is. So that means you know their personality, you know more about that person. So you're able to identify at that species and strain level. You can identify bacteria, fungi, protists. And then really the question is when do we use a functional microbiome analysis? Because we know that traditional tests are going to be limited really to those with GI symptoms and conditions. So a functional microbiome analysis is really looking at someone who has symptoms within the GI tract, but also wanting to understand more of the impact that the microbiome has beyond the gut. Because people that have leaky gut, they don't always experience symptoms in the gut. We know that intestinal permeability is linked to neuroinflammation and infertility and stubborn weight loss or weight gain and autoimmunity. So we can really get a greater insight into that microbiome's impact. So it's going to help us really decide that next sort of clinical course. How strong is someone's microbiome, or do we need to do some rebuilding and reconditioning prior to doing more aggressive treatments? Do we need to really work on the microbiome so we can see that effect that it has beyond the gut and determining what we need to essentially do next? So it can be a great way, really great way to help streamline some of that clinical course of action. So it's not about diagnosing conditions based on a single marker, right, or specific microbes, because you can't. It's about gaining that valuable insight so that we're looking to really restore balance and build that resiliency. And just so everyone knows, we have lots of resources available. We have report recommendations, interpretation guides. The report recommendation will give you some insight into the nutrition and lifestyle and supplement recommendations for each marker. We also have lots of different resources. We have these webinars. We have interpretation guide, like I said, we have 60-minute consults with each new test. We have external consultants. We have internal, myself and the rest of the clinical team. So we have 30-minute ones for just quick questions, especially if you get more familiar with the test. We have lots of webinars, lots of opportunities, and of course, access to our clinical teams. So ultimately, we're getting, like I said, a more granular view of the microbiome using a little bit of a different technology. So Biome Effects has a robust, healthy sample population, very large, actually. It's very simple. You've got lots of leaders in clinical support, microbiome education. We have lots of ability to help give you actionable results. And we know that it's research-based, it's clinically validated, and we've got obviously insight that's being provided that's going to really help direct your treatment plans to restore that balance. So just a couple final questions. Who here now, if you're not using Biome Effects, is interested in becoming more of a Biome Effects expert? Let me know one or two. Great, love it. And then a final question. So can we make a diagnosis? Can we use this test or stool test in general to make a diagnosis based on the microbes or based on microbial composition? One, yes, or two, no. You're right. And I think that's important to understand, right? And that's really what's leading us into the next set of our webinar, and the other webinars a part of this series is how can we use this test and what type of microbial signatures will we see on this test that can give insight into upper digestive disorders, lower digestive disorders, gut-brain dysfunction. So we're going to learn a lot more about that throughout this series. So with that, we do have upcoming education. Angelica mentioned our mini keynotes that's coming up with Dr. Lavelle and myself. We're going to talk a lot about the microbiome and weight loss and all the things that's really predominant in the news now. And then our first foundation series, which really coincides very nicely with this, to learn more about a little bit more about the digestive tract, the microbiome, changes in the microbiome, very stuff that a lot of us haven't gone back to since we were in school for all of this. So really fun to listen to. We also have a very special coupon for you guys today. So make sure you take a copy of it. This is going to give you 10% off your entire cart, free shipping. And this coupon has been extended for 2 weeks. So hopefully you're thinking of someone that you're seeing, a patient of yours that you have that may be a good candidate for this test that you can get started on. So I just want to say thank you. I will leave this up. And I don't know, I can't even see. Okay, so we have a few minutes. I'm going to try to pull up the Q&A because I can't pull it up. Okay, so can you briefly explain how this test differs from GI map? Great. So that goes back to a little bit what I've talked about in that earlier section, where GI map is going to give you, because it's using this 16S technology, again, you're really only able to see who is in the microbiome, and the accuracy does change a little bit based on the ability. Oh, okay. I can't even see. Maybe some of these have been answered, but I'm going to keep going with this question. So basically Biome effects, because you're gaining that functional profile, you can actually get more information on the root of what's driving a lot of the dysfunction. So like I talked about a little bit about the difference between stool short chain fatty acid metabolomics versus the genes. So you can actually get to the root of who is there or what they're not doing or who's not there that can be driving a lot of the dysfunction that we see. So it's just a different type of test. The functional microbiome analysis gives you a little bit more of that granular view of someone's foundation. So yes, you're going to see different bacteria, but again, because of that different technology, we're able to actually look at the functional profile. What are your microbes actually doing? So living in the Pacific Northwest, I'm wondering if seeing higher Ascomycota is more prevalent due to damp conditions over half of the year. That's a great question. I'll have to reach out to some of our Pacific Northwest. So Ascomycota, a lot of times I'll see that more elevated in someone who's going through like active remediation, who really has some active, mold toxicity. So a lot of times if I see that elevated and symptoms are corresponding, I will have someone go do further mycotoxin testing. In what direction does one look when a highly diverse diet, including lots of polyphenols, is in place and someone's been working with spores for almost a year with MegaPre? What direction? So I'm not sure I understand the question, but someone who's got lots of polyphenols, someone who's been using functional fibers like what's in our MegaPre, I would hope to see that we're starting to build that diversity. We've done studies even looking at the combination of Megaspore with MegaPre, and we did see increase in diversity. We also saw an increase in those key health promoting species, your commensal bacteria like Akkermansia and Faecalibacterium. So we would see that. Now, if you're not, then again, what else could be impacting that? So this is where you have to take a step back and look at the lifestyle, look at someone's diet, what other conditions, and sometimes our microbiome is very flexible. Oh, I see it, but not there we go. I'm going to that question. So if you're not seeing that, then again, take a look outside of what's going on beyond their diet, look at their lifestyle, look at what other conditions they may be dealing with. And maybe there's just, again, it's taking time. It's taking a little bit more time. Maybe we need to add a little bit more in to see if we can try to push the needle a little bit. So I have seen that before. And so then I look at, do they still have a lot of other pathogens or other opportunistic bacteria that could be competing? So usually, again, when we have people do this test, we generally will say, retesting can be anywhere from 6 months, as early as 6 months, but I usually don't retest people for 9 months to a year because sometimes it can take a little bit more time to see some of those microbiome changes. And then what are you maintaining them on? Have they been taking it, every day? Are you down to just a maintenance? Maybe we need to do more of the full dose a little bit longer. Are there markers on the Biome effects test that can make you suspect to mold and certain SIBO? Yes, so please stay tuned for the next Biome effect, or not the next one, the third Biome effects, where Alicia will actually go through upper digestive disorders. So showing you microbial signatures and patterns that are really predominant with SIBO. Mold, again, you'll see obviously dysfunctional gut barrier. So things like low keystones, low diversity, but you may see that Ascomycota a little bit elevated. You may see more pathogens elevated. Can this test be covered by insurance? So unfortunately, it's not. Like many of the other tests. A lot of functional tests are not covered by insurance. Are there any symptoms you look at when Prevotella is 0? Prevotella is an interesting one. Prevotella, they've done research now to show that low Prevotella can actually make it harder for people to lose weight. But why are we often seeing low Prevotella? It's because we a lot of times don't have that diversity within the diet when it comes to our fiber. So Prevotella especially through industrialization, we've lost a lot of it. So I look at someone's fiber intake, because even though I always like to say a lot of my patients have like an unhealthy, healthy diet. So they eat really good quality foods and they have some fiber, but most of us don't have a lot of that fiber diversification. So I look at the types of fibers. I challenge, my patients to try to get, even myself, and I challenge us at home to get 20 to 30 different, types of fiber per week. And it gets really hard. So I will look at, if they have low Prevotella, again, look at kind of weight. But on the flip side, again, because we know that our microbiome likes balance, really high Prevotella can sometimes be a sign of dysbiosis. It can sometimes be a little bit more profiled or patterned in things like autoimmune conditions like rheumatoid arthritis. With that, everyone, I thank you all so much for being with us today. I know I went over a little bit, but hopefully everyone will get the recording and the slides, and hopefully you're excited to start to become more of a microbiome expert. So thank you, everyone, for joining us today.